Okay. We now reconvene for the next session of our conference. Thank you for rejoining us, and we look forward to engaging an insightful continuation of today's program. Before we move on to the third session, I'd like to remind that the scientific paper presentation will be conducted in boardroom 105 K block at 2 p.m. I kindly request all participants scheduled for the paper presentation to assemble there on time. Thank you for your cooperation, and I wish all presenters the very best. We shall now proceed to the third session. I'm delighted to introduce the chairpersons of this session, Ma'am, Professor Dr. Bandana Devi, Principal, Arya College of Nursing, Guwahati. I request Hannah Smita to escort Ma'am. Ma'am began her professional journey as a ward in charge cum nursing tutor at Shatri Baris Christian Hospital, Guwahati, serving from February 2001 to March 2008. She then joined Arya Nursing College, Sangsari, Kamrup, as a clinical instructor from March 2008 to June 2011. Owing to her exemplary leadership and academic excellence, she was appointed Vice Principal from June 2011 to November 2016. An accomplished scholar, she has published research papers in international journals and presented scientific papers at various nursing conferences and workshops. Her academic contributions further extend to reviewing chapters of nursing textbooks and scholarly manuscripts. We are truly privileged to have you, ma'am, sharing this session. Please give a round of applause for ma'am. The second chairperson is Sir Dr. Joydeep Goswami, COE, Assam Downtown University. I request Roman to escort Sir to the stage. Sir began his academic career as a research associate at Northeastern Hill University, Nehu, in Shillong. In 1996, he joined the field of higher education as a lecturer in economics in Assam and subsequently rose to the position of head of the Department of Economics. A dedicated scholar and researcher, Sir has authored books, published several research papers, and prepared numerous project reports. He possesses vast experience in teaching economics at both undergraduate and postgraduate levels and has made valuable contribution to academic research and policy-oriented studies. We are truly privileged to have you, sir, sharing this session today. Please give a round of applause for Sir. Ladies and gentlemen, please join me in extending a warm welcome to the exceptional speaker, respected Ma'am, Dr. Nidhi Yadav, Associate Professor, International Institute of Health Management Research, New Delhi, with a round of applause. Ma'am will be sharing her insights on planetary health, climate action, and disaster response. Without further ado, I request our esteemed chairpersons to highlight the audience with Ma'am's accomplishment and competence and to officially open the session.
Good afternoon, one and all present over here. Honorable dignitaries, esteemed speakers, guests, organizing committee, and delegates of today's conference. First of all, I extend my heartfelt gratitude to Madam Professor Dr. Manasi Sen Gupta and the organizing team for inviting me as one of the chairpersons for today's conference. I am honored and delighted to be here to share the session of our distinguished research person, Madam Dr. Nidhi Yadav, Associate Professor, IIHMR, New Delhi. Madam has over 13 years of professional experience in hospital operations, healthcare quality and quality management. She has the expertise in hospital management, quality assurance, disaster management, and healthcare administration. She is also an experienced academician involved in teaching, research, and professional training in healthcare management. She is awarded with doctorate in hospital management with specialization and in disaster management. She is masters in hospital management with specialization in quality management from IIHM Jaipur. She is awarded with dual master's degree in business administration from Punjab Technical University. She is an external assessor for National Quality Assurance Standards, Ministry of Health and Family Welfare, Government of India. She has numerous publications and an active researcher in healthcare quality, hospital management, and disaster preparedness. She has contributed to academic teaching, curriculum development, and professional education in health management. She mentored many students and healthcare professionals in quality improvement initiatives. She involved in promoting evidence-based healthcare practices through research and academic engagement. Madam has enormous leadership role. She is an external assessor for National Quality Assurance Standard. She leads academic and professional activities related to quality assurance and healthcare management. She always supports healthcare institutions in implementing accreditation and quality standards. So, as we know, a healthy planet and the healthy individuals are interrelated. So, climate change, frequent disasters, and our environmental degradation, biodiversity loss, these are some of the greatest challenges facing humanity today. So considering all this area and challenges and means looking for the solution, Madam has been given the topic for today's conference: planetary health, climate action, and disaster response. Now, I request Madam Dr. Nidhi Yadav to enlighten us with her presentation on this vital topic. So time will be allotted for your presentation is 1 hour. At the end of the presentation, time will be given for a short question answer session. Now time is yours, ma'am.
Thank you so much. Good afternoon, everybody. Good afternoon, everybody. Last bench. Good afternoon. How many hands? How many hands from the last bench? So I see people are awake after lunch. Now I see people are awake after lunch. So, good afternoon once again, beautiful night angles. So the topic for today's discussion is a very sad topic: disaster response, disaster preparedness, climate change. Lot of bad things you are going to hear. That this is happening to the planet, this is happening to the climate, this is happening to the disease transmission process, and this and that. But we'll see the brighter side out of it. We'll try to see the brighter side out of it and how nursing professionals can be a part of advocacy, can be a part of planning, can be a part of execution for ensuring that this agony is reduced. The sad things that we are going to discuss in terms of numbers, that this is not happening, the numbers are poor, MMR is very high, NMR is very high, disease transmission is going at a very high pace, climate is deteriorating, Mother Earth is suffering, things like that. So we'll see what is the silver lining in it, and how nursing and public health through a multidisciplinary approach can help live a better life with the given circumstances. That's all. That should be the life approach. Whatever situation faces us, we make the most out of it. We try to minimize the damages. That is what we are doing right now, and do the right thing right every time. Like you do for the medicines. You do the right medicine, right time, right dose, right route, right person, right frequency, right documentation, and right to refuse. So if we do the same thing right for our planet also, and minimize the damages that are happening incidentally, right? So that is how the presentation is shaped. So don't get bogged down by the negativity of the topic, disaster response, preparedness, mitigation, and things like that. Let's see what future brings to us. So, do you ever feel that the things are interconnected? Yeah. So the first thing is a question from my side to you. Do you ever feel that it is interconnected? The planet, the word planetary health, climate response, and disaster preparedness. It is interconnected. So for me, planetary health, for you, planetary health, for me, disaster response, for me, climate change, for you, climate change, these three things are interconnected. They can't be seen in isolation or in silos from each other. That is what we are hearing from the morning. So let us see what planetary health actually means. When I say planetary health, what does it actually mean to you and me? So the definition for planetary health, or in simple terms, the description of planetary health is, it asks us as to see human health not as something isolated within hospitals or clinics, but as dependent on the condition of the natural system that supports life. So the natural system, what does this means? And why does it matter to all of us for that matter? Because any system that goes around cannot be working in isolation without affecting the corresponding systems around it. So what are the corresponding systems and the effect could be for this interaction? Anybody? What could be the effect of interaction of two systems? Extreme weather events, diseases, food insecurity, that is the fallout. That is the fallout that we see when the systems interact and reproduce something. Displacement of population, pollution levels rising, and mental health stressors. So how many people in the room, if I may ask, would say that I am affected by some or the other mental health issue? Or for example, I have seen a disruption. Let's not go to mental health, I should ask this question other way. How many of you feel that I have been through a disruption in my life? Disruption could be change of job. Disruption could be a breakup in the relationship. Disruption could be loss of family member. Disruption could be a pay cut, a salary cut, loss of leaves. Disruption could be the missing onto the birthday party of a friend. That could also be a disruption. So how many of you could say today that I have faced a disruption in my life in past 6 months, for example? Show of hands. I have also faced a disruption. I lost my phone. That's also a disruption of service. So anybody who feels there is a disruption in the life, please show your hands. At least 20 hands I could see. So some or the other form of disruption we have seen. Now believe me, if this disruption is compounded with a stressor like displacement, a stressor like climate extreme, a stressor like flood, a stressor like an extreme weather event, there will be compounding effect, and then it will lead to mental health issues or mental health stressor. So it begins as a disruption combined with climate change effect leading to a mental health issue, and in totality it is called a disaster event at life level. Disaster event could be at property level, where the property is damaged because of the cloudburst, because of earthquake or a landslide. The airports are damaged, the railway lines are damaged, the schools are damaged, the hospitals are damaged. But when the life is affected, that is the first damage. Second is the property damage. Third damage that a disaster can lead is business continuity. The damage to the business continuity. So whenever an event qualifies to be called as a disaster, it has to have these three effects: life loss, property loss, and business disruption. Okay, so anything that disrupts. So now can you connect a climate change event happening at one place, a disruption happening in your life at one level, compounding with system effect, leading to a disaster event? Can you connect these three dots? Okay, so point taken, these are interconnected: planetary health, climate, and your disaster response. So the objectives for this session will include, I'll try to explain how climate change affects human health. I'll try to identify evidence-based health sector responses. How do the health sector responds to these changes? And describe core features of the climate resilient health system. So when we say resilient, it tells the capacity of the individual, of the property, or of the system to resist the stressor and bounce back in shortest possible time. Once it is affected, to bounce back to its normal operations in shortest possible time. That is my resilience. Okay. And lastly, we'll try to discuss interdisciplinary approaches to disaster preparedness. You must be hearing this interdisciplinary thing a lot, right? Interdisciplinary thing a lot is being heard since morning. So what does interdisciplinary means is, I think, is clearly drilled into the heads by now. Interdisciplinary is when two disciplines, or when more than two disciplines, talk to each other, understand each other, exchange information, and feed each other back. They work in tandem with each other. That is what is interdisciplinary. So nursing discipline can be interdisciplinary with, can somebody tell me what all interdisciplinary approaches can be seen from the nursing side? नर्सिंग डिपार्टमेंट किसके साथ इंटरडिसिप्लिनरी हो सकता है? सॉरी, एजुकेशन डिपार्टमेंट एंड nursing can be interdisciplinary with education and research. सुबह से कितना सारा सुना है ना इंटरडिसिप्लिनरी, इसीलिए मैं फीडबैक ले रही हूँ. फिर 4 क्रेडिट्स नहीं मिलेंगे. कम्युनिटी, एजुकेशन, रिसर्च, कम्युनिटी, एग्रीकल्चर, रेल एंड रोड ट्रांसपोर्ट. हाँ, ये सारे एटलीस्ट इंटरडिसिप्लिनरी है. वाटर, हाईवेज, सप्लाई चेन, pharmaceuticals, these are interdisciplinary. Can you function in a hospital as nurses if the supply chain is cut out? When I say supply chain, I don't only mean medicines and consumables. I mean fuel, I mean water, I mean food, I mean linen, I mean gases, medical gases. So can you function in a hospital if you do not have food supply for the patient or for the staff? If you do not have adequate potable drinking water, can you function in a hospital? Can your OT function if there is no clean linen available? No. So these are interdisciplinary, they are cross-cutting. So fuel is important, right? Water is important. So nurses have to come out from the wards and intensive care units and should know what is the fuel capacity of my 200 bedded hospital. What is the fuel capacity? How many diesel generator sets do I have in my hospital? Because if the earthquake happens or landslide happens or a flood happens, my electrical line is cut out. How will my hospital survive? For how long it will survive and will be able to cater to patients? Because if there is no electricity, can you run the ventilators? Can you run the OT? Can you give emergency services? Is it of any use, the hospital? Even the patients who are currently admitted, can you give them clinical services without electricity? So you will depend on generator sets. Generator sets run on fuel. So how many generator sets and how much fuel do you have? Can anybody answer in the house? No. So this is interdisciplinary. That as a nurse, you should know. That is why nursing administration is coming up in a big way. So nurses not only provide clinical services, yes they do at the baseline level, at the very basic elementary level. When they enter into the field, they generally enter as clinical providers. But as you grow up in the ladder, you need to know the administrative part of it, that my hospital has this much fuel capacity. I can function in my ward for at least 72 hours without electricity, depending on the generator set. I have this much water storage in my overhead tank, and my bore well can function for this much capacity, else I will be dependent on tankers. Okay? Because in the event of a stressful situation, when a disaster strikes or a extreme climate event happens, it is the nurses who have to cater to the surge of patients. Surge, everybody understands? Surge is the increased number of patient influx in a short period of time following a disaster event. So your emergency can treat, for example, 40 patients on 8 beds average in 24 hours time. But if those 40 patients come to your same emergency within 1 hour over those 8 beds, can you handle them? No, you can't. So you need extra beds, you need extra hands, you need extra linen, you need extra pillows, you need extra IV sets, you need extra IV stands. You need extra place to lay those beds, or at least those mattresses. Where is that place? So you need to mark that place well in advance when it is a hunky-dory situation, that in case of an event, when I am flooded with this kind of surge of 40 patients, I can have these extra 32 patients put on these mattresses in this area which I will evacuate, which is currently my parking area or my patient waiting area or whatever area, and I can cater to them. Slowly I will shift them into the system. Somebody will go to ward, somebody will go to radiology, somebody will go to OT, somebody will deteriorate and die. So, but I have to accept 40 patients. That is my surge capacity, right? So that is what interdisciplinary I am talking. So nurses have to look at themselves from this point of view. They should not just focus on clinical discipline, providing clinical care. That is also a part of the business, but your 20% of time should at least be spent on administrative thinking. Okay, that is the clear take-home message when I say these things are interconnected. Everybody is with me? How many are sleepy? Okay, so importance, we just discussed the importance. Why this subject is important to all of us? Because it does not affect an individual. Climate affects an individual. Anybody would say that climate has affected this individual, A, B, C. Climate affects a system, a group of people, is a group of institutions, a exclusive set of people or exclusive place, and then the dominoes effect start. For example, there are less rains in this year, for instance, then there are crop losses, there are losses of the cattle, there are fuel prices going up, there are food prices going up, extreme weather events, more heat wave that year, lot of students falling sick because of heat wave in the school, and the chain reaction keeps going. So we cannot say that climate event has affected this particular individual or this particular institution, this particular set of system. It affects a set of people who are more vulnerable, who are more exposed or have the probability and less resilience to the extreme events, and eventually it converts into a snowball effect, what we call as a snowball effect. If you try to throw a ball from the hilltop, a snowball, as it goes down it increases in size because it catches more snow. So it's called a snowball effect, where it starts as a single event or a group or a smaller event, and over a period of time it multiplies fastly. So, and health impacts are already visible in every region. This also cannot be denied. Health impacts of the climate change events are visible in almost every region. So I can't say that Assam is less inflicted and Sikkim is more inflicted. Or I can't say that northern India is more affected and southern India is less affected. Entire globe is affected in one or the other way, and it keeps happening to one or the other state. Even at this point of time while we are talking, I would say India has approximately 750 plus districts, and there are 750 plus district level disaster preparedness plans customized to the climate change events and the disasters faced by those districts. So every district has a characteristic, every district has its own set of climate events and set of disaster events, risk facing those districts, and the customized plans for that. So health impacts are not uniform. They are very extremely variable, and they are specific to the situation. And they are linked with, of course, the emergencies that arises out of that, because of and these emergency finally lay stress on your health system. Emergency kahan jayegi patient ki? Whenever a patient falls sick, whenever there is an emergency, a mass casualty event, where does the first responders come from? First responder kahan se aata hai? First is the community response, and finally the fallout is on the health system, isn't it? So this is what we just discussed, planetary health. It is the human, this thing we should get into our heads, that planetary health is my business. Planetary health is not the business of Assam Downtown University or my faculty colleagues or my principal or my dean or the resource person who is standing here or the researchers, etc. It is my business. It involves me, it affects me, it can start from me, and my actions can have an effect on it. So planetary health, human health depends on this natural system, and it is my business too. Environmental degradation can undermine health, livelihood, sustainability. So this is just we talk that environmental degradation at any level, it has a bearing, a snowball effect, which I just discussed. And planetary health uses a system lens rather than a narrow disease lens. So when I say that heat event has happened, a heat stroke event has happened, it is not a person that is to be treated, or you treat say five children coming to your hospital. You have to look at it from the system level. From which school did they come? What was the eventuality in that school? What was the economic status of these students? Why did they fall sick? Was it only the heat stroke? Was it allied factors? Was it the larger, the longer exercise period? Can it have a dominoes effect? Is it that I can expect more such patients in my hospital? Should I wait, or should I escalate the issue? Should I talk to the school authorities that these kind of events can happen more frequently because of any XYZ activity at the school level? And where is that school placed? In which district? In which block? Can the similar heat wave pattern or the temperature pattern is seen in the entire block, in the entire district? Because it's not just one event, it can be a chain of events. Other students might be suffering, or other patients might be suffering who may not be coming to you. So epidemiologically, when we see a case, we have to go look at it from the systems lens. So that is what is the take-home message from this slide. And the definition that I just discussed, planetary health is the health of human civilization and the state of the natural systems on which it depends. So human health and the natural system, they have to talk to each other. Now there are different layers to climate change. Climate change does not happen on its own. It is also interdisciplinary. It talks, it behaves, it does not stays alone. It has different layers to it. So what are those layers? What could be the direct effect? There are certain effects that I have written. The examples that are taken is heat illness. What could be other effects that you can imagine from direct effect of heat event or direct effect of climate change that comes to your mind? Heat stroke, heat illness, waterborne diseases, climate extreme events, mental health stressors, waterborne diseases. These are the direct effects, very, very visible, extremely visible to the eyes. What could be the indirect effects? What should I say as indirect effects? Second layer, it can translate into food insecurity, water insecurity, vector-borne diseases and air pollution. Can you see air pollution? Can you see air pollution? How many say yes? Can you see air pollution? How many say yes? How can you see air pollution? Please explain. Can you see the AQI numbers, air quality index of your city? How many of you believe that AQI gives the correct connotation of air pollution? AQI at least you can see, AQI, air quality index. Can you see pollution now? If the AQI is 350, what does it implies? AQI of 100, which is more polluted, 100 or 350? 350 is more polluted, everybody feels that? Okay, what if the AQI is 650? It's a smog. Smoke and fog mixed together, breathing difficulty, precipitated cases of COPD, elderly is coming to the hospital, ICUs flooded, and ventilator beds non-available. That is a sequelae. Okay? And then of course lot of effect on pregnant women, lactating women, children under 5 years of age, and things like that. Okay? So AQI is the direct indicator of air pollution. But again my question comes back to, can you see air pollution? You cannot see it directly, but there are indicators to it. So this is the indirect effect I am trying to say. Indirect effect समझ आया आपको? Second layer of indirect effect is this. What is the third? Systemic effect. What is the systemic effect? Systemic effect generally includes disrupted care supply, care delivery, supply chain, displacement, and mental health burden. Can you correlate climate event or a climate change with displacement of population? Climate change and population displacement. Any example from anybody on which they have seen that climate change happened in this area for a period of time and population is displaced because of that? People are moving out, flood, that's a temporary displacement. There are cases where permanent displacements have happened, people have escalated, they are bound to leave their places because of the climate event. Now, can you tell me an event other than climate? An event other than climate which has caused displacement of population? War-like situations, cross-border terrorism, infiltrations, COVID-19, more or less war-like situation, pandemic level, black swan event. It's a black swan event, happened once in a millennia, and it has left the marks on almost everybody's life in one or the other way. So, displacement because of climate event. Earlier displacement was seen mostly as a fallout of war-like situations where refugees used to move, or migrants basically. Cross-border migration used to happen, that is called the refugee movement, where the refugees from the war-torn countries used to move from one place to the war place to the safer place, and they used to transit from across the countries and across the borders, many cities they used to travel, and that is how displacement was seen. But now for shorter duration also you can see displacement of population where people migrate from Odisha or from Jharkhand, they go to Tamil Nadu, Kerala for work, for labor for 4 to 5 months, and they come back to the system. They come back to Odisha, Jharkhand, Chhattisgarh after 4 months of labor work basically. Okay, so this kind of displacement also you are seeing because there is less economic or you can say financially supporting activities in this region because of climate change. So this region is dry. Chhattisgarh, Jharkhand has a dry spell of say 4 to 5 months, and now this population who has lack of work and lack of income sources moves from this Jharkhand, Chhattisgarh area to the area where there is more of labor work. They go as agricultural laborers or industrial labor, they earn there for 4 to 5 months and then come back. Now, what is the fallout of this? हमारे देश के ही लोग हैं. We all are citizens of India. What is the harm if few thousand people move from Chhattisgarh to Tamil Nadu for every 5 months in a year? What is the harm? Do you see any harm, any wrong in this? They had a drought, they have less water availability in Chhattisgarh, Jharkhand, their crop is less, their agriculture produces less, so now they are moving to another state to earn their livelihood. What is wrong in that? Why should we discuss? Try to think from the system's point of view. Try to think as a public health nurse. Try to think as a nurse posted in Tamil Nadu, and she has to take care of these people for 4 months or 5 months. What comes with them? It affects the demography, 4 months, okay, fine. And economic balance, chalo, they are there to earn, okay. Try to think from the health perspective now. Some communicable diseases, okay. Huh? Shortage or burden on healthcare services of Tamil Nadu because the pregnant women will require a delivery. She will require vaccination. The child she delivers will require vaccination, and an elderly who is traveling with the family will require NCD care. Isn't it? So, the health system, financials or resources which are parked in Chhattisgarh will be spent on these people in Tamil Nadu, from the Tamil Nadu kitty. So, the stress is put on Tamil Nadu, or for that matter any state which they travel to. And in the meantime, many of these things gets missed. It's not about the expenditure now, that who bears the expenditure, either this state or that state. The thing is, if the mother misses the ANC checkup, or if the mother misses essential immunization, or if the child does not receive an institutional delivery, what happens after that? Or if it's a high risk pregnancy, she does not get a PMSMA clinic, the NCD, the elderly who is traveling with that family has a discontinuity of medication. He has to buy it out of pocket. Isn't it? So it's a fallout. So it is not just this displacement which bothers us, but as public health professionals, be it public health researcher like me or public health nurse like you or a public health administrator, you should think from the system's lens, that a person moving in the system because of a climate event can affect the system in a much larger way. समझ आया? कितने लोगों को समझ आया? How many have the buy-in for this? किसी को समझ नहीं आया? हाँ आया. Okay, I wanted to check if my point is clear across the table, or is it just I'm talking to the walls? Because the buy-in is the nurses now have to think beyond clinics. So this planetary health, या आप सैटेलाइट पे जाके तो सोचोगे नहीं, मैं भी सैटेलाइट पे जाके नहीं सोचूंगी, धरती पे ही रह के सोचना है. We have to think while we are in the house. Okay, so how should we think? That is the whole idea I am trying to push in. So when you think of a person affected by climate change, don't think of him as an individual. Just think of it as a system who will require these facilities. Okay, so that you will be able to differentiate between the effects and the impact. Any questions from this slide? I am just taking one example and trying to explain what is direct, what is indirect, what is systems effect, etc. But the systems work like that only. Okay, so let's take an example again from heat as a health emergency. So what do you understand from this slide? Heat waves or heat stress is the fastest and the clearest growing challenge. Everybody talks about heat. Na? We talk less of water, we talk less of earthquake, we talk less of landslide, we talk less of cloud burst, we talk less of glacial lake outburst floods, we talk less of urban floods, we talk less of even pandemic, but we talk a lot about heat, because heat is a very frequently occurring phenomenon. It happens in our state, in our district, then in adjacent district, then in adjacent state, then in the region, and then sometimes in the entire belt. Right? So heat is spoken more frequently. That is why I have taken the example of heat also. So why it is important to talk about heat? Besides the fact that it is very frequently occurring, very widely discussed, it has an impending effect and a compounding effect. What is a compounding effect? The snowball that I was talking. It has a snowball effect. It affects entire range of population in one or the other way. So it has from top to bottom affected anybody and everybody. It aggravates the situation. It worsens the problem, and it affects the system at the large. It starts from the person and finally affects the system. Okay, I'll just give you an example. For example, the non-communicable diseases, the deaths because of non-communicable diseases is found to be high in the population affected by heat waves. There are established studies. Okay, so any non-communicable disease person you are dealing with and you come across that person during a heat wave situation, it is a high alert situation. So at the person level, you have to do that kind of advocacy. Then responsively at the system level, you have to jack up the supplies for that heat event so that you have adequate ORS with you, you have adequate communication material with you, and adequate communication channels to spread that information. And then the recipient have to be sensitized in the language that they understand. So you start from a person to his NCD, to your supplies, to the preparation of your emergency for receiving more of such patients in the eventuality, because if suppose suddenly in the assembly time 15 students collapse, there is assembly going on in a school and 15 students suddenly collapse, where will they go? They'll come to your facility, they'll come to your hospital. So you have to prepare your facility. Then who treats them? The nursing colleagues, the medical officers. So you need to tell, or you need to sensitize them that this season with this range of temperature and this frequency of and sustainability of these high temperatures, this kind of patient influx is expected. This kind of information have to be discussed. That generally comes from the top management and from the IMD. So from the individual level of a nursing personnel and an individual patient, it starts and it goes up to the level of Indian Meteorological Department, IMD. So, and the system talks to each other. IMD talks to the system, the hospital systems, the health ministry, the district level administration, the supply chain effects, and they issue advisories. No movement between 12 noon to 3 p.m., labor time changed, school timings changed, water bells in the school after every hour, and other informative materials, lot of information on the social media, etc. And it finally percolates down to the lowest person between a staff nurse or a treating nurse and the affected patient. So it rings the bell at all the levels. So that is why heat is discussed so much, and it is very important to be discussed. So this is just an example. And of course heat wave exposure is increasing with the climate change events as they increase over a period of time. So the next question is everybody affected equally by disasters or by climate change events? How many say disaster affects or climate event affects everybody equally? It is affected equally. How many say it is an equal effect? How many say it is a partial effect? Or disasters affect the vulnerable more vis-a-vis the stronger less? Okay, how many of you know swimming? Show of hands. How many of you know swimming? 1, 2, 3, 4, 5. Okay, approximately 15 people in the house know swimming, including the controller Saab. He controls the examination. So it's like controller Saab. So 15 to 20 people in the house know swimming. So suppose there is a flood event. I also don't know swimming. Suppose there is a flood event in the city. So what is the probability of survival of these 15 people vis-a-vis the left of us? Who survives? Who has a higher chances of survival? The one who knows swimming. So it is variable. Okay, how many of the people in the house, the girls who are wearing sari, know swimming? The girls in saris who know swimming? 1, 2, 3, 4, 5. So now the girls in sari vis-a-vis the girl in suit, if somebody is wearing a suit, what is the chances that she will swim better vis-a-vis the suit girl? Who will swim better? The suit, one who is wearing suit, or the one who is wearing a sari? The one who is wearing a suit has a higher chances, has a better mobility, and chances of survival are higher. So it is affected differently between the people who know swimming, isn't it? Okay. So it is, the point is, disasters don't affect everybody equally. Now suppose, how many of you have a spectacle on your eye? Now take off the spectacle. Please take it off for a minute. अपनी आँख से चश्मा निकाल दीजिए 1 मिनट के लिए. अब कितने लोगों को मैं सही से नजर आ रही हूँ? So you guys are more vulnerable to a visual stimulus vis-a-vis those who are not using a spectacle. So a simple aid has, removal of that simple aid and adding on that simple aid has made us less or more vulnerable. And a simple skill like swimming has made us more or less or unequally variable. A simple dress, difference of the dress, both are Indian dresses, I'm not talking about Western right now. So both Indian dresses have different vulnerability quotient, correct? So now, from now onwards, nobody should say that disasters or climate events affect us equally. ठीक है? Point clear? So anybody says that, ask them to remove their specs and tell me how, ask them what is this, how many numbers. Okay? Do this exercise with them. So according to you, after this exercise, who do you think is more vulnerable? Somebody who has these features, who is an elderly, for instance, who is lactating mother, who is pregnant, somebody who is child, somebody who is underage, okay, somebody who has socio-economic difference, somebody who has communication differences. Suppose I don't know SMEs, suppose it is a reality, I don't know SMEs, and if there is a communication going on in SMEs regarding a flood alert, I won't be able to capture it, and I won't be able to react to it, I won't be able to evacuate myself, and I become more vulnerable. So in spite of the fact that there are no other vulnerabilities, a language barrier makes me more susceptible to be affected by a hazard event. ठीक है? So all these factors put together, or in silos or in isolation, can increase or decrease my vulnerability, and the vulnerable ones are more harmed, more affected, need more care, need more communication inputs at the time of a disaster event, including a climate change event. So बच्चों के लिए heat advisory अलग जारी किया जाता है ना, audio visual होता है. It is not always a written text. How to make a ORS, है ना? How to do complementary feeding. For example, if it's a mother, if it's an educated mother, there is a different means. If it's an uneducated mother, how to prepare a top feed. There is a difference. How to do breastfeeding, even breastfeeding. You can't just say कि mother है इसको पता होगा. If it's an educated mother, she can read. There is a different set of information, pieces of information you can tell her in a written form. Vis-a-vis if it's a illiterate mother, you have to draw and then tell ki this is how you feed the baby or breastfeed the baby. So that is the difference I'm trying to trying to explain here. People with chronic illness or disability, this is also another component which adds to the vulnerability. So now the question is, how is this climate action and health, how do they interact or intersect with each other? So there are three things. One is prevention and mitigation. So either you prevent the thing or you mitigate it. Or mitigate is reducing the effect. Mitigation is not completely making it zero. Okay, mitigating is reducing the effect. So if I have a poor eyesight, how do I mitigate? I wear a spectacles. If I don't know swimming, how do I mitigate? I learn swimming, or at least I buy some gadgets which make me afloat. Okay, what tires ho gaye, floaters ho gaye, flippers ho gaye, so that in the event of a flood I at least don't drown till the time the help arrives. So there are strategies for prevention and mitigation. For example, you reduce the pollution levels, you plant more trees, you get respirators, or you change the place at the time of a high pollution AQIs in your city, things like that. So you prevent it and you mitigate the event. So that is how you can minimize the damage to the health. Second is adaptation. Adaptation includes few aspects where you prepare for the unavoidable. So what could include in adaptation, if I have to say from the nursing point of view? Give any example for a climate event that this is how we can adapt. We can adapt ourselves. Any example? Sorry? Wearing of PPE during the COVID. So we adapted ourselves on donning and doffing. We trained ourselves donning and doffing techniques. We made donning and doffing corners. We learned hand washing. We implemented hand washing and we practiced it. So that is how we adapted to the threat of a pandemic. The threat that is it posed to us basically. That is a clear example of adaptation. We made a lot of posters, we made a lot of audio visual inputs so that everybody, even if it is the nursing staff, the attendants, the doctors, the patient themselves, they were following this. Okay, that is a part of adaptation. Then this adaptation is applicable to all the events, all the climate events, be it flood, be it heat stroke, be it your landslide. Landslide many times is not related with climate event unless it is preceded by an earthquake, mostly earthquake, then landslide, or a heavy rainfall and a landslide. So that is how they are interlinked. So all these events, they can have an adaptation strategy in line with the relevant aspects. Then health co-benefits. So cleaner and the last point tells us about if we do prevention, mitigation and adaptation, how the fallout comes to us. So it does not come directly, it does not come in a very tangible way many a times, it comes as an indirect impact or as a very less kind of, or what should I say, not very tangible and feasible or visible kind of effect. It comes in a long-term effect. It sets in as a long-term effect where there are lower pollution levels, there are more cleaner space, the lungs are created in the city, for example. So they create a lot of avenue for cleaner air. So it is not a direct impact, it can be an indirect long-term health benefit. That is how it plays. So another thing is, when we say climate resilient health system, which we just saw in the previous slide, it also brings a point to us in terms of low carbon health systems. So what do you mean by low carbon health system? Any thoughts on that? If I ask you, can you reduce the carbon footprint of this conference? This conference has produced some carbon. Our gathering, me coming from Delhi, flying in a plane, landing at the airport, a car comes and picks me up, parks me in a guest house where I run the AC 24/7 because it's very hot. Is there some carbon generation? I'm consuming a lot of energy, and after one day, tomorrow when I go back, after shopping, I go back, I again fly back, take the taxi, from airport I take the taxi to my home. Am I generating a lot of carbon? I'm consuming a lot of fuel. This is all carbon. So now, in the hospital, can you think of the activities which generate carbon? Sorry? Running of intensive care units, running of OTs, ventilators, boilers, chiller plants. What is a chiller plant? Everybody says yes. So I asked, what is a chiller plant? What is a chiller plant? It is a part of your air handling unit, AHU, which produces fresh air and cold air, with the right combination of gases, okay, which is circulated into your hospital system inside and makes the air breathable. That is your air handling unit, and that is what a chiller plant does. It cools down the air, reduces the humidity to a habitable level, okay. Habitable level of humidity is 45 to 55% in the air, okay. So that is what a chiller plant do, and it runs on electricity. So when you run a chiller plant, you consume lot of electricity. Have you seen pneumatic chutes in the hospital? Have you seen pneumatic chutes in the hospital? Lifts in the hospital? Lifts you have seen here, they all consume electricity. So, any idea, next question is, any idea on how much carbon is the healthcare industry contributing to the entire carbon ecosystem? Suppose there is 100-point carbon infusion on earth in a day. So out of this 100, how much is contributed by health sector? 5, 10, 15, 20 points. How many? How many points? If there are 100 carbon points every day from road transport, air transport, industries, manufacturing, this and that, do you think healthcare industry is contributing to it? Yes. How much? How many points approximately, or what percentage? Approximately 4%. So every 100 points carbon that goes up in the environment, 4 is contributed by the health sector. And it's a good number, huge number. Okay, and we can work on it by reducing the number of trips that our lift takes, the number of trips that the pneumatic chute takes, the number of trips that the person has to do to deliver a file, then he comes back, delivers a medicine, then he comes back, delivers a some other document, etc., using the lift. So that is called mapping. So if you do the mapping, you can really reduce the carbon levels of the hospital, and hospitals have done that by minimizing the traffic movement in the hospital, by reducing the air conditioning load, by switching over to green energy and green spaces where you cool down the space inside naturally, so that you do not require that many AC hours. Air conditioning, running of air condition can be reduced. So your chiller plant works less, you consume less fuel, and of course same goes for water, same goes for fuel, same goes for other things, and gases, medical gases also. Okay, so that is what carbon I am talking about right now. Do you now get it what carbon is? Okay. So but this carbon, can a nurse do it alone? Can a public health person do it alone? None of us can do it alone. So we require leadership and governance. We make policies at the hospital level, at the block level, at the district level, state level and national level, on to reducing the carbon footprint of the industry that we work into. Okay? And those policies can be adapted to your hospital. So try to look for these things wherein you can find out the policies where adaptation is possible and leadership governance plays a major role into it. Then climate informed surveillance system. What is a surveillance system? Surveillance is identifying the hotspots as soon as possible or as timely as possible and reporting them. Disease surveillance सुना है? Integrated disease surveillance program सुना है? IDSP, Integrated Disease Surveillance Program. This is a program of Government of India to identify notifiable diseases at elementary levels as soon as possible so that they are flagged before they spread into a full-fledged disease. Okay, so the same thing can be done for climate. I just gave the example of a child or a group of children falling in the school because of heat stress. That was the example of climate surveillance, where you go back and check whether this school is affected, what is the exposure time for these students, is there a heat wave going on, is the school not following it. That has to be done at leadership level, of course, but then you feed back into the system that heat stroke cases or diarrhea cases are reported from this particular school or this particular community, and there are chances that it may escalate at a higher level. The patient load might increase, so the hospital needs to prepare, the community needs to prepare, the system needs to prepare. That is what it means. Then resilient facilities where we do not fall prey to the climate event, right? We do not fall prey to the climate event, and we need to have our own resilient plans and resilient policies which work in tandem with the climate event that faces. Will Assam prepare for a cyclone event? How many of you have seen Punjab? Anybody from Punjab side? No. Anybody from Uttarakhand? Himachal? Do you think Himachal will prepare for a cyclone? It will never happen in Himachal because they do not have an ocean, right? So you do not prepare for something which does not faces you, right? So you have to know your own risk profile, your own hazard profile, what risks are applicable to you and at what percentage. So you do hazard risk vulnerability analysis, HVRA. That is called HVRA, hazard risk vulnerability analysis, so that you do not prepare for cyclone, and Uttarakhand also does not prepare for cyclone. Okay, it's only the coastal states which prepare, right? So there are categories of event which will never happen in a particular area, and that is what being risk informed means, and that is basis that you develop your resilience planning. Of course, you train your workforce to increase your resilience, because the plan that you prepare has to be executed by your trained manpower, isn't it? Trained hands can only implement it, and any plan that is to be implemented has to be backed up by sustainable finances. So you need to have backups, you need to purchase supplies, you need to park those supplies, and for that you require finances. On an average, a hospital spends or parks approximately 2% of its budget for disaster preparedness. That's the national average. Okay, for infection control, for quality processes included in that. So in total, if your budget is say 100 crores a year, you park 2 crores only for disaster preparedness in the year. And it goes into training, capacity building, procurements, refurbishments, strengthening the system, damage control, preventive maintenance, etc. Okay, that's the ballpark figure. And low carbon emissions.
Sorry to interrupt, ma'am. Time is running short.
Sorry, I'll just try to wind up as soon as possible. So evidence-based health sector responses, they are dependent on early warning systems. What is an early warning system? Do you get alerts on your phone? Lightning alerts, these are our early warning systems, generally produced by IMD using the satellite mapping with the help of ISRO, Institute of Space Research, etc. Risk communication, vulnerability adaptation, we just talked about all these things. Disaster preparedness in climate era. So how do you prepare for a disaster event when it is coupled with the climate change? So it is not only the earthquake which is affecting, but it is followed by a landslide and heavy rains. What happened in Wayanad, Kerala? Anybody has heard of that event? Wayanad, Wayanad in Kerala, they suffered heavy rains followed by a massive landslide, sea level surge, people getting killed or being buried under the debris, livestock killed, agricultural fields damaged because of the water surge, followed by infectious disease spread, because the dead bodies going into the water or rotting leads to surge of infectious disease. So that chain reaction happened, which is what I am trying to say, disaster preparedness in the era of climate event. So it is not the climate change that you have to look alone in the systems process side, but also a climate or disaster event either preceding it or following it, because it all have a stress on the health system. Every patient of the landslide, of the flood event, and of the communicable diseases will come to the hospital eventually. So that is what this slide talks about. This was the opening question only. Can health do it alone? In isolation? You need help from meteorological department. You need help from disaster management authorities, state level authorities, national level authority, water sanitation, urban planning, agriculture, community organization, NGOs, donors, volunteers, etc. So you need a cross-cutting approach. We need a cross-cutting approach, and nurses have to play an integral role in that. How I am going to come to that? This is a case that we discussed, the heat exposure case that we discussed. So how nurses have to contribute to it is clinical care during climate related emergencies. That is the first response when the patient comes to you or a trigger comes to you, followed by a climate informed preventive and adaptation strategy that you have to be a part of. So nurses do not have to think exclusively of nursing care now. They have to think of strategies, advocacy, planning. You have a lot of scope of working with WHO, UNICEF, NGOs besides your clinical work. So that is another domain you can explore. You can work for WHO, you can work for strategic management, you can work for UNICEF, you can work for a lot of NGOs which are there in the space of preparation, mitigation, climate change, climate action, etc. And system strengthening for resilience. System strengthening could be the in-house system, departmental system, and systems at district level, state level, national and international level. So these are the few examples that we just discussed. Why nursing? Again, you are the largest and most viable, visible group of health professionals, and that's a fact. I don't need to explain that to anybody. You spend most of your time with patient care management. You know the patient the best, and you know the system also the best. Only thing is you need to learn how to advocate for your own system, how to learn strengthening that system, you need to learn to speak for it. And you are the bridge between the clinical care, public health and community service. This is what we are talking, cross-cutting, vertically and horizontally. This is what nursing should do and pursue as career. They are trusted communicators, and they are the first one to recognize the emerging patterns. That is what is the disease surveillance I was talking about. You pick up the first case as soon as possible, as early as possible, as timely, and report it to the authority before it translates into a large-scale pandemic or an epidemic. So in short, I should not read this slide. In short, be informed, stay informed, learn, execute, practice, join hands with public health and administration, try to pursue your career into administration and contribute to the larger policy making space that you can work with besides your clinical care practices. So nurses are of course very important for the bedside clinical care, but I see nursing into policy making domains, into advocacy, promoting these aspects at national levels, at district levels and international levels. So nursing have to think from that point of view now. It is not just clinical bedside patient 8 to 2, 2 to 8 and 8 to 8 and then off. The morning, evening, night off is not nursing. It is beyond that. Okay, thank you so much. Now I think this is the last slide. Any questions? Should I start?
Yeah, good afternoon, everyone. Yeah, first, I'd like to thank Dr. Yadav for wonderful deliberation, starting with the disorders and coming down to the nursing management and the role of nurses in the real world. Now, I will just take 1 minute of you, don't worry about that. Uh, because by nature I am a teacher, so I cannot resist myself from speaking at least a few words, because the concept itself was very interesting and knowledgeable also. Now, Dr. Yadav was talking about disorders. I will further go. This disorder started with the Industrial Revolution in the 17th and 18th century. What we have started, we started developing. For development, we need industries. For industries, we are competing and thereby destroying the climate. What you have already seen, the disorders she was talking about, every one of us has gone through some form of disorder, and very recent disorder I remember is the COVID-19. That was the largest disorder what we have faced in the recent years. I don't know, Dr. Yadav, how many of us here understand the heat related issues? Now, the heat we talk about in Northeast and the heat we talk about in Delhi, very different. I don't know how many of you have faced, but still at 48 degree, I like the heat in Delhi, then 34 degree heat in Guwahati. I have been in Delhi, I was in Delhi, and I used to like, only thing, you must have a full stomach water and at least food in your stomach. You will not have anything. But here, I don't know. Now, this is actually vicious circle. Development leads to the curve, and she also talked about the nursing, the role of nurses in the modern day world. When we were small, we used to go to the hospital with our parents to see the nurse aunties, they look after us, giving injection and all this thing. After coming to the downtown, when I find a nursing department, I saw and understood the role of nurses, not only in the hospital, but outside also, in academics. Particularly, I have learned so many things, the role of nurses in academics nowadays. That is what we have. But when we were small, we used to go to the hospital, we used to, oh, nurse auntie is only there to give injection. That is what we were scared of, all the nurse aunties. But the situation has changed. Anyway, with that, I wanted to thank the organizer for organizing such a wonderful conference, national conference. I thank Dr. Nidhi Yadav, coming all the way from Delhi, from my city to Guwahati. I still consider Delhi as my city, to Delhi, to talk to you, delivered a wonderful lecture. It must have helped you, and of course, it will help you in the future also. I thank my co-chairperson who introduced the session. I thank Nirmali ma'am. Moreover, most importantly, Dean of Faculty of Nursing, Mansiben, and all other faculty members. Thank you very much.
Thank you, sir. As an expression of gratitude and appreciation to Ma'am Dr. Nidhi Yadav for her outstanding contribution, I call on stage respected Ma'am Professor Dr. Nirmali Gogoi, Associate Dean Research, Faculty of Nursing, Attitude to kindly felicitate Ma'am. Thank you, ma'am, for doing the honor. And once again, thank you, ma'am, for your expertise and illuminative session. I request Ms. Meghna please escort ma'am back to her seat. Now, it is our honor and privilege to felicitate the chairpersons of the conference, Ma'am Professor Dr. Bandana Devi, whose inspiring leadership and unwavering support have been instrumental in making this event a success. As a token of our appreciation and respect, I would like to invite Ma'am Aparijita Goswami, Associate Professor, Faculty of Nursing, to kindly come forward and felicitate our Honorable Chairperson, Ma'am Professor Dr. Vandana Devi. Thank you, ma'am. I request Mr. Roman to kindly escort ma'am to her seat. May I now request Sir Dr. Joydev Goswami to kindly come forward and accept this token of appreciation as a mark of our gratitude and respect. Thank you, ma'am, for doing the honor. I request Roman to escort Sir back to his seat. Ladies and gentlemen, as we come to the close of this enriching and inspiring conference, I would like to take a moment to express our heartfelt gratitude to all those who made this event a grand success. And in a short moment, we will continue with the cultural program by our students. In the meantime, I request all the delegates to take a few moments to complete the post-test questionnaire by using the scanner displayed on the screen.
Ladies and gentlemen, we shall now proceed with the certificate distribution. I request one from each hospital, as I've called out the hospital name, one delegate from each hospital to come forward and receive the certificate. So I take this privilege to once again proceeding with the valedictory session. Now I will like to invite once again Madam Professor Nongmeikapa Monica, Associate Dean, Faculty of Nursing, to grace the stage and do the honors of distributing the certificates to the delegates. So as I announced the list of the institute, one delegate from each institute, please come forward and receive the certificate. Nalbari Nursing and Paramedical Institute, Army Institute of Nursing, NTS ESI Hospital, Healthcare Nursing Institute of Science and Paramedical Technology, School of Nursing, PB Civil Hospital, Nagaon, Assam, Rahman Institute of Nursing and Paramedical Science, CPMS.
They might have not heard also. You repeat from number 1.
Nalbari Nursing and Paramedical Institute, Army Institute of Nursing, NTS ESI Hospital, Healthcare Nursing Institute of Science and Paramedical Technology, School of Nursing, PB Civil Hospital, Nagaon, Assam, Rahman Institute of Nursing and Paramedical Science, CPMS College of Nursing, GNM School of Nursing, Mukalmua, School of Nursing, Majuli, Niru Bora Institute of Health and Science Education, Nightingale Institute of Nursing, Morigao. I request one delegate from each institute to please come forward and receive the certificate. NTS ESI Hospital, NTS ESI Hospital. Next is Healthcare Nursing Institute of Science and Paramedical Technology. NTS School of Nursing, BP Civil Hospital, Nagaon, Assam. GNM School of Nursing Mukalmua, School of Nursing Majuli, Niru Bora Institute of Health and Science Education, Nightingale Institute of Nursing. After Nightingale, I'll call again. Next is Upper Isthmian. Thank you, ma'am, for doing the honor. Now I would like to invite ma'am Pilawan Kantiv Suchen for doing the honors. So the institutes are Mirza Institute of Nursing and Health Sciences, Gohain Institute of Nursing, Panjabari, Mercy School of Nursing, Nagaon, Pratiksha Nursing College, Health City Institute of Nursing and Paramedical Science, Mirza Institute of Nursing and Health Sciences, Gohain Institute of Nursing, Panjabari, Mercy School of Nursing, Nagaon, Pratiksha Nursing College, Health City Institute of Nursing and Paramedical Science, Dispur Nursing Institute, Jorhat Institute of Nursing, Kolyapani, A&M Training Center, Morigao, GNM School and Paramedical Institute, Gopur, Regional Institute of Paramedical and Nursing Science, A&M GNM School of Nursing, Nagaon, Apollo College of Nursing, School of Nursing, Nalbari. Mercy School of Nursing, Nagaon, Pratiksha Nursing College, Health City Institute of Nursing and Paramedical Science, Dispur Nursing Institute, Jorhat Institute of Nursing, Kolyapani, A&M Training Center, Morigao, GNM School and Paramedical Institute, Gopur, Regional Institute of Paramedical and Nursing Sciences, A&M GNM School of Nursing, Nagaon, Apollo College of Nursing, School of Nursing, Nalbari. Regional Institute of Paramedical and Nursing Science. Now I'll be announcing the list of the hospitals. Please, one delegate to come forward. Health City Hospital. And I take this privilege to once again invite Ma'am Ruchika Devi, Assistant Professor, Faculty of Nursing, to kindly do the honors. Health City Hospital. Pragjotishpur Medical College and Hospital. B. Bora Cancer Institute, Guwahati. A&M GNM School of Nursing, Nagaon. Downtown Hospital. Northeast Cancer Hospital and Research Institute. Northeast Cancer Hospital and Research Institute, 11 Mile, Jorabat. Swahid Kushal Konwar Civil Hospital. Assam Medical College and Hospital. Assam Medical College and Hospital. I kindly request the delegates please come forward. Swahid Kushal Konwar. Swahid Kushal Konwar Hospital. Oh, okay, okay. Huh? Ha, ha, ha. Go, go. Next who's next? Show me next. A&M GNM School of Nursing, Nagaon. Oh, go, go, go. Rahman Hospital. I request the delegates to please stay for a few minutes. We have a cultural program coming up. Please don't go yet. From here. Which one? Assam Medical College and Hospital, Rehman Hospital, Barpeta Medical College and Hospital, GNRC Dispur, Apollo International Hospital, ESIC Medical College Hospital, LGB Chess Hospital Sonapur, District Hospital Sonapur, Guwahati Medical College and Hospital, Chandrapur Model Hospital. Done.
Attention please. All the participants for poster presentation, please come forward. I request all the participants for poster presentation, please come forward. Now I will announce for the best poster presentation. It goes to H. Sobeni Devi. To give away the prizes to the winner, I would like to invite on stage Ma'am Professor Dr. Nirmali Gogoi, Associate Dean Research, Faculty of Nursing, Assam Downtown University. Everyone give a round of applause. Thank you, ma'am, for doing the honor. Now I request all the participants to come one by one to collect their certificate. Ms. Thejang Gunomor, Hanasmita Das, R.K. Sharmila Devi, and Prinkala Das. Please give a round of applause for all the participants. Thank you, ma'am, for doing the honor. Now, for the paper presentation, the best paper presentation goes to Dolly Das Biswas. I request Professor Dean Ma'am, Dr. Manasi Sen Gupta to please collect the certificate on her behalf.
Nirmali ma'am.
I request Nirmali Ma'am to please come on the stage. And the second prize goes to Dr. Dhanjita Deka Ma'am. Please give a round of applause.
Other participants, please come.
I request all the participants for paper presentation, please come forward to collect your certificate. Once again, I request all the participants for paper presentation, please come forward to collect your certificate. Ms. Sumita Bhattacharya, Joyshri Paul, Shushmita Sinha, and Pranita Gogoi. I request our Dean Ma'am to please kindly come forward to give away the prizes for the participants. Thank you, ma'am, for doing the honor. Good evening, ladies and gentlemen, respected delegates and dear participants. As part of our ongoing commitment to professional development, we conducted a pre-test before the session began, followed by a post-test to measure the knowledge gained through our program. I am happy to share that the result shows a significant improvement in understanding and skills, which reflects your dedication and active participation. The pre-test gave us a baseline of participants' understanding at the beginning of the session, while the post-test reflected how much knowledge was gained through the course of this event. We are happy to report that the average performance improved significantly, sharing the effectiveness of the session and the enthusiastic participation of our attendees. The pre-test score was 70%, while the post-test increased to 94%, indicating a commendable positive increase in subject understanding by 24%. Thank you all for your active engagement and commitment to enhancing your knowledge and skills.
I request everyone, please rise up. It is my great honor and privilege to respectfully welcome our esteemed and visionary leader, our very own Honorable Chancellor Sir of Assam Downtown University, respected Sir Dr. N.N. Datta Sir, in today's event. Ladies and gentlemen, please join me in welcoming our Honorable Chancellor Sir with a big round of applause. So now we will begin with the cultural program. First we will start with the South Indian dance, followed by 7 sisters and 1 brother dance. So I request the student for South Indian dance to please come forward to the stage.
తెల్లవారే వెలుగురే కలా పచ్చ పచ్చ పచ్చి మట్టి బొమ్మల అల్లి బిల్లి వెన్న పాల నురగల అచ్చ తెలుగు ఇంటి పూల కొమ్మల దేవదేవుడే పంపగ ఇలా దేవతే మా ఇంట అడుగే పెట్టెనంట బ్రహ్మ కళ్ళలో కాతులే మా అమ్మలా మా కోసం మళ్ళీ లాలి పాడేనంట. చూపిస్తాంది తుంటరి చూపు ఊరికే ఉండదు కాసేపు అస్తమానం నీలోకమే నామై మరపు చేతనైతే నువ్వే నన్నా నాన్నెత్తర కులాసా నీ కలలకి చేసా నీ కోసం వయసు వాకిలి కాసా నా అసలు పోగేశా నీ గుండెకు అచ్చేసా నీ రకకు రంగం సిద్ధం చేశా ఎందుకు పుట్టిందో పుట్టింది ఏమో నువ్వంటే ముచ్చట పుట్టింది పుడతాని నీ పిచ్చి పట్టింది నీ పేరు పెట్టింది వయ్యారం ఓడి కట్టింది గోరింట పెట్టింది సామికి ముక్కులు కట్టింది చుట్టమల్లే చుట్టేస్తాంది చుట్టేస్తాంది చుట్టమల్లే చుట్టేస్తాంది రరరే ఎన్నెన్ని తీరాలో నీకు నాకు మధ్యన ఉన్న కాస్తైనా అట్టే కాదు
నీతో ఉంటే తెలియదు సమయం నువ్వు లేకుంటే ఎంత న్యాయం గడియారంలో సెకనుల ముల్లే కంటకి కదిలిందే
నీతో ఉంటే కరిగే కాలం నువ్వు లేకుంటే కథలను అంటూ నెలలో ఉండే తేదీ కూడా ఏడాదయ్యిందే హైలెస్సా హైలెస్సా నువ్వొస్తావని ముస్తాబై చూసా
Wow. Wow, what a performance, right? That was an eye-pleasing performance. Thank you, students.
Up next, we have 7 sisters and 1 brother dance. Let us all welcome the performers on stage with a big round of applause.
ఓ జానో
काकेन 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 काकेन
दूतया पागेत केतलफ्ते परिणमल काकेन 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 Chinongkaya ipagkaya landunaso lutong da adubagling da na chilichi Nandilay ang dagising kiba Anang bahirig singna Pagsising kain ikaw lang Ikaw tahali Jang damingay Trabanagon amadi Loto na lady tayo bang landa Jang damingay Trabanagon amadi Loto na lady tayo bang landa Imagisyon Imagisyon
Yaitre ham yam le Anneni hevon hevon Yau Vietnam buanin Yaitre uli kundam Yaitre ham yam le Anneni hevon hevon Yau Vietnam buanin Yaitre uli kundam Gusto da bodaseng Dati man tualang tuan Underun talabay Akajay kagundan Akundet yung ilahi Yo iumi patay Namisi chasasi Dari kibrutika Yaitre ham yamli Anneni hevon hevon Yau Vietnam buanin Yaitre uli kundam कमरैमा पटुकी कसेर मुसु मुसु हाँसेकी बसेर कमरैमा पटुकी कसेर मुसु मुसु हाँसेकी बसेर रुकुमै कोठा रुकुमै कोठा रुकुमै कोठा रुकुमै कोठा रुकुमै कोठा आँखा नि राम्रै हो पर्यो नि मोटा ए आँखा नि राम्रै हो पर्यो नि मोटा
Wow, what a breathtaking tribute to the heritage of Northeast India. Thank you, students.
I humbly request our very own Honorable Chancellor Sir to please share a few words with us.
Actually, Manasya, I am very sorry. You have been telephoning me because though I am the Chancellor, I have got some other works to do, not so many works. Nurses, we have decided today, we have decided today that meditation classes will be started from the first year of the nurses. That's good. Are you happy? The nurses, many people believe doctor earns the money, nurses give the service. Is not it? And nurses are always there by the side of the bedside, dying patients. And they get the blessings, and blessings you cannot buy in the market. I shall tell you a story of Einstein. Have you heard of Einstein? Einstein was a scientist. His IQ was 180. Our IQ may be 100. So then when Einstein was a German and the nurse looking after him was the English lady. So Einstein, one word was costing million. So he spoke something in German. And that poor lady, she did not understand anything. So when Einstein died, she started sobbing. What did Einstein say? Because he must have told some very good things which she could not understand. So that's why you also try to learn languages. In our downtown hospital, we give some prize, extra remuneration to nurse who knows other language. Okay? So Manasi, please tell them. I just thought Einstein, that nurse was sobbing because she could not understand what he was telling. And his one word was maybe a million. Thank you so much for waiting for me.
Thank you so much, sir. We are here with us.
Now, to formally express our gratitude to all those who made this conference possible, I now invite Ms. Hannah Smita Das, first year MSc Nursing, to deliver the vote of thanks. I request Ms. Harshita and group to be prepared to lead the state anthem and followed by the national anthem.
Good afternoon, everyone. It is a great honor for me to deliver the vote of thanks as we concluded the meaningful celebration of 6th National Conference 2026. First and foremost, our heartfelt gratitude goes to our Honorable Chancellor, Dr. N. Dutta Sir, for gracing this conference with your esteemed presence. I extend my sincere appreciation to our Honorable Vice Chancellor, Dr. N.C. Talukdar Sir, for your constant encouragement, valuable guidance, and gracious presence at this conference. I extend my heartfelt thanks to our esteemed chairpersons, Professor Dr. Vandana Devi, Principal, Arya College of Nursing, Dr. Joydeep Goswami, COE, Assam Downtown University, Professor Mrs. Manjula Hussain, Principal, Apollo College of Nursing, Dr. Minmoy Basek, Director, DIA, Assam Downtown University, Professor Kobita Boissaw, Principal, Army Institute of Nursing, Dr. M.K. Modi, Executive Dean, Assam Downtown University, whose guidance and leadership has been instrumental in making this conference a success. I equally thankful to our guest of honor, Ms. Junu Sharma, Registrar, Assam Nurses, Midwives and Health Visitor Council, for joining us today despite your busy schedule. Ma'am, your kind words and presence has been truly inspiring for all of us. A warm thank you to our speakers, Dr. Nidhi Yadav, Associate Professor, International Institute of Health Management Research, New Delhi, Ms. Avandi Gopan, Nursing Consultant, Principal and Assessor, NABH, Dr. Fahad Akhtar Jaman, Professor, Department of Community and Family Medicine, AIMS Guwahati, for joining us and sharing valuable insights with us. Your words have added immense value to this conference, which always serves a source of motivation. I extend my heartfelt gratitude to our Dean, Professor Dr. Manasi Sengupta ma'am, whose leadership, vision and support have been the backbone of this event. Thank you for guiding us every step of the way. I also thankful to Professor Dr. Nirmali Gogoi ma'am, Associate Dean Research, and Professor N. Monica ma'am, Associate Dean Academics, for your continuous encouragement and thoughtful support throughout the planning and execution. I sincerely thank Ms. Lokimi Gogoi ma'am, Principal, Sankar Madhav School of Nursing, for her support and commitment throughout the conference in her absence. I deeply appreciate the presence of all our expected judges from various faculties of Assam Downtown University. Dr. Manoj J. Bora, Additional Dean, Faculty of Engineering, Dr. Parthabotim Datta, Associate Professor, Faculty of Pharmaceutical Science, Dr. Manjusa Deka Saikya, Associate Professor, Faculty of Humanities and Social Science, Dr. Vishwa Prasun Chatterjee, Professor, Faculty of Science, for judging the scientific paper and poster presentation. Your valuable time, expertise and fair evaluation have upheld the spirit of academic integrity and excellence throughout the scientific session. A big thank you to all the organizing committee for your planning and tireless effort behind the scenes. You have made everything run smoothly and seamlessly. To all the students, thank you for your enthusiastic participation and also for your dedicated support. Your energy and teamwork were truly commendable. I also thank the media personnel for covering today's event. My sincere appreciation goes to non-teaching staff, IT department, support personnel, graphic design department, housekeeping staff, last but not the least, canteen services. Your quiet contribution assure a warm welcoming and a well-managed environment. To each and every one of you here today, thank you for your time, your presence and your support in this conference. We are eagerly waiting forward to welcoming you all again at the next year's conference for another opportunity to learn, collaborate and advance the nursing profession. Long live Faculty of Nursing, long live Assam Downtown University. Thank you once again. Thank you.
After the national anthem, I request all the students, please be ready for the photo session. Please don't go, okay?